A 24-year-old male client is seen in the emergency department with a report of weakness, nausea, vomiting, and fever. On assessment, he has abdominal pain in the upper right quadrant of his abdomen, along with scleral icterus. When asked about recent travel, he states he returned from a trip to South America 2 weeks ago. Based on these findings, liver function tests are ordered. Now, liver function tests, or LFTs, are a set of tests that check the health of the liver by measuring the enzymes and other substances made by the liver. First up is alkaline phosphatase, or ALP for short, which is an enzyme found mostly in liver cells, which are called hepatocytes, as well as in bone cells and the placenta. Next is alanine aminotransferase, also known as ALT, and aspartate aminotransferase, also known as AST. Both ALT and AST can be found in the liver, kidneys, heart, and skeletal muscle. Another enzyme is gamma-glutamyl transferase, or GGT, which is mostly present in the liver. Finally, there's bilirubin, which is a product of the breakdown of hemoglobin found in red blood cells. This type of bilirubin is referred to as unconjugated or indirect bilirubin. Once it reaches the liver, bilirubin is converted into conjugated or direct bilirubin and eliminated through the bile. Total bilirubin is a measurement of both conjugated and unconjugated bilirubin. Now, LFTs can be drawn on their own as a liver panel or as part of a complete metabolic panel. The normal value of ALP ranges from 30 to 120 units per liter. ALT ranges from 4 to 36 units per liter. AST ranges from 0 to 35 units per liter, and GGT ranges from 8 to 38 units per liter. These ranges can vary slightly between sexes, and could be higher for those with a higher body mass index. Lastly, total bilirubin values range from 0.3 to 1.0 milligrams per deciliter. Alright, so there are some conditions like hepatitis, liver cancer, and fatty liver disease, as well as certain medications like acetaminophen that can damage the liver, causing its enzymes to leak out into the blood, resulting in elevated LFTs. Liver enzymes will also rise if there are problems with the hepatobiliary tree, like biliary obstruction or cholecystitis. Additionally, the AST to ALT ratio can be used to more closely determine the cause of liver injury. If AST and ALT are higher than ALP, the cause is likely hepatocellular disease. On the other hand, when ALP and GGT are higher than AST and ALT, the cause is most likely related to biliary stasis. For clients with alcoholic liver disease, the AST to ALT ratio is typically 2 to 1 or more, and the GGT level is also useful in detecting chronic alcohol ingestion. Lastly, bilirubin is increased if there's extensive blood hemolysis, or when the liver is damaged, resulting in jaundice. Jaundice can be clinically apparent when the total serum bilirubin exceeds 2.5 milligrams per deciliter. Now, a client's LFTs will be measured when there are signs or symptoms of altered liver function, like fatigue, nausea, vomiting, right upper quadrant pain, or jaundice. LFTs will also be measured when monitoring clients with acute or chronic liver disease, or when checking liver function tests in clients taking hepatotoxic medications. Okay, let's look at nursing management for a client with altered liver function tests. Goals of nursing care are to assist in identifying and treating any underlying cause. Begin by collecting a sample by venipuncture. Before collecting your sample, remember to confirm if your client should be fasting before the test. Typically, you'll use a tube with a red top. After obtaining your sample, gently invert the sample several times, but avoid shaking the tube, as this will cause hemolysis, or breaking apart of the red blood cells, which will alter the results. Now, if your client has elevated LFTs, assess for signs of liver injury, like right upper quadrant abdominal pain, fatigue, nausea, or jaundice. Also, check for other symptoms that indicate impaired liver function, like easy bleeding or bruising that could be related to decreased clotting factors. If these are present, also check prothrombin time, or PT, and international normalized ratio, or INR. If edema is present, check their albumin level. Then, withhold any potentially hepatotoxic medications, and administer IV fluids and medications to treat the underlying cause, as prescribed. Finally, for any client with altered LFTs, review their medication administration record to identify medications that can interfere with your client's test results, including acetaminophen, allopurinol, phenobarbital, phenytoin, oral contraceptives, salicylates, and statins. Alright, it's a quick recap. Liver function tests are a set of tests that check the health of the liver by measuring the enzymes and other substances made by the liver, including ALP, ALT, AST, GGT, and bilirubin. Elevated liver function tests can occur with conditions that damage the liver and the hepatobiliary tree, as well as with certain medications. Liver function tests are measured when there are signs or symptoms of altered liver function, when monitoring clients with acute or chronic liver disease, or when checking liver function in clients taking hepatotoxic medications. The sample is drawn by venipuncture using a red-topped tube. Nursing implications include assisting in identifying and addressing the underlying cause.